So now I'm going to talk to you about a paper we published in 2016. Dr. Mariela Lopez published it. I was the anchor author. What we did was we looked back at a paper we had published about young women who developed breast stria or stretch marks after breast augmentation. What we noticed in that previous study that we published in the Aesthetic Surgery Journal was that all of the young women that formed stretch marks had their surgery between days 14 and 28 of their menstrual cycle. So then we decided to look and see where young women had elective surgery and whether the timing of surgery had an effect on their results. The results of that study were profound. So we published surgical timing and the menstrual cycle affect wound healing in young breast reduction patients. We published this paper in 2016 in the Aesthetic Surgery Journal. What we found out in this paper was that young women, 27 and younger, who had a breast reduction surgery sometimes had complications. They'd have a small area of the wound open up, or they'd have part of the wound form a hypertrophic or thickened scar. The results of our study showed that if women had their breast reduction between days 14 and 28 of their menstrual cycle, they had a 9-fold increase in surgical complications, dehiscence, wounds opening up, or thickened, hypertrophic, big wounds as a result of surgery when we monitor them over the next 6 months. Whereas women who had their surgery between days 1 and 14 had a vastly diminished incidence of surgical wound dehiscence and hypertrophic scars. The results were profound when we looked at the two groups. In fact, here's a table showing the difference between the two groups. This bar right here, the tall one, that's women who had their surgery post-ovulatory, days 14 through 28. The small one is the number of women who had their any wound problems who had their surgeries in days 1 through 14. Big difference. This was statistically significant to a large degree. And so what the take-home message is that there are different wound healing properties and capabilities depending upon when you operate on women, young women. We think that it might have implications for other types of patients, and that's the subject of some ongoing studies that we're doing in the medical center with some other specialties. That's it for now. I'll talk to you next time.